Tinnitus is the perception of a sound when there is no external noise. How can you tell if you have tinnitus? Although often referred to as ringing in the ears, tinnitus can manifest many different perceptions of sound, such as ringing, hissing, whistling, buzzing, and clicking. In rare cases, patients report also hearing music. Tinnitus may occur temporarily or continuously, but there are two specific types. Subjective, when noises in the head or ear are only perceptible by the patient, as it is in 99% of cases. Objective tinnitus, on the other hand, when the noises in the head or ear are audible to other people as well as to the patient. These sounds would be produced by an internal blood flow function or by musculoskeletal movements of the body, but this is only in 1% of cases. The sound we humans perceive happens because tiny hair cells in the inner ear move when sound waves arrive. This movement causes electrical signals to be sent through the ear to the auditory nerve in the brain, which interprets these signals as sound. Tinnitus can arise as a result of an underlying cause that is often related to a health condition. Among the most common causes are hearing loss, because the auditory cilia in the inner ear bend or break down either because of age or because of overexposure to loud noise, which can cause electrical impulses to leak to the brain for no apparent reason. Ear infection or ear canal blockage. Blocked ear canals can be caused by a buildup of fluid, infection, wax, dirt, or other material that can alter the pressure in the ear and cause the tinnitus. Injury to the head or neck. A bump or trauma to either of these two areas can affect the inner ear, the auditory nerves, or a function of the brain that is linked to hearing. Tinnitus may occur in only one ear with this type of injury. Some medications, specifically in high doses, can also cause tinnitus. These include non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen, antibiotics, as well as some cancer drugs, antimalarial drugs, antidepressants, and even diuretics. Other less common causes would be as an early symptom of Meniere's disease, where there is abnormal otic fluid pressure. By muscle spasms, temporomandibular joint problems, blood vessel conditions such as atherosclerosis and high blood pressure, for example. Neurinoma, which is a benign tumor in the cranial nerve that affects balance and hearing, but also other tumors in the head, neck, or brain. Thyroid problems, migraines, diabetes, anemia, or other autoimmune disorders such as rheumatoid arthritis and lupus have been linked to tinnitus. Anyone can suffer from tinnitus. It doesn't matter how old you are, but your lifestyle does. There are some risk factors that can increase the occurrence of tinnitus, and these are constant exposure to loud noise, as happens to people who work with heavy machinery, saws, firearms, as well as frequent and loud use of portable music devices. With age, because the number of nerve fibers that function in the ears decreases, deteriorating hearing and can lead to tinnitus. Gender. Men are also more likely to get tinnitus than women. And finally, certain health problems such as obesity, high blood pressure, cardiovascular conditions, and autoimmune conditions such as arthritis increase the risk of tinnitus. Taking care of your ears is important in many ways. Cleaning is one step, while preventing and treating infections is another. Ear care also includes taking measures to avoid unnecessary loud noise and regular monitoring for possible hearing loss. But first, clean your ears with special care. Do not clean your ears with anything smaller than a wipe on your finger. Do not use cotton swabs, bobby pins, or sharp objects to clean your ears. These objects can damage the ear canal or eardrum. Wax is the ear's way of cleaning itself. But if you have a buildup that prevents you from hearing, see a health professional to help remove it. Some preventive measures to consider are like turning down the volume. Listening to loud music with or without headphones can contribute to hearing loss and tinnitus. If your work requires exposure to loud noises such as machinery, power saws, firearms, or music, wear hearing protection. Maintaining good cardiovascular health is key. Physical exercise is a good approach because it improves the functioning of your circulatory system, activating regulated blood flow to the brain and associated areas. Tinnitus can be improved in many people by treating the underlying cause or with treatments that reduce or block the noise so that the tinnitus is felt less. Here I suggest some preventive treatments that may help you, such as acupuncture and supplements such as ginkgo biloba or the mineral zinc. Stress can make tinnitus worse, so it is important to use practices such as relaxation, meditation, and physical exercise, which can provide relief. In stronger cases where tinnitus is really difficult to control and affects your daily performance, it is best to consult a specialist. In the content box of this video, you will find a link to the full article with more detailed information. If you like this video, please click on the like icon. Remember to subscribe on the red button and activate the little bell to receive notifications every time there is something new to learn in nature's way, in the art to heal yourself. See you soon.